Hi, this is Anu and you're watching Anu for Nurses. Today we shall review hyperaldosteronism. From the name itself, it says it is the hyper secretion of aldosterone. I hope you remember the normal physiology and the production of aldosterone. Remember the association with ACTH and renin in the release or the secretion of aldosterone. So, from the pituitary, you've got ACTH that's stimulating the adrenal cortex, especially which cells in the remember the acronym GFR. So, it's a glomerulosa to release aldosterone. And also the JG cells, the juxtaglomerular cells of kidney also produces the renin. This also stimulate adrenal gland to secrete this aldosterone. This aldosterone acts on DCT, that's the distal convoluted tubule, and sodium water reabsorbed, potassium is excreted. And this is the normal mechanism that happens. And what is happening in hyperaldosteronism? There will be increased retention of sodium and water. This hormone function is exaggerated. So what happens is definitely will lead to hypertension and there will be hypernatremia. And important features of hypernatremia are thirsty. Patient feels thirsty and there will be changes in the mucous membrane, especially there will be swollen, dry tongue. And the late sign is muscle twitching, or you can say the DTR will be increased. So that's a very important feature of hypernatremia. And there can be alkalosis. How come alkalosis? Usually sodium absorption will be linked with H plus ion excretion. So H plus ion number increases, there will be acidosis. That determines the acid or base level. So when there is too much of H plus excretion, there will be alkalosis. What are the other features? Aldosterone main function is sodium water reabsorption and potassium excretion. So there will be loss of potassium and this can lead to hypokalemia. How this hypokalemia manifested as, like there will be decreased bowel movements, that means constipation, muscle weakness and cardiac rhythm changes. Very important thing, or the important nurse's responsibility when the patient is on hypokalemia is cardiac monitoring. The changes that usually we see are the prominent U wave and there will be ST depression. And hypokalemia can also lead to polyuria. How come polyuria? Hypokalemia causes vasopressin receptor resistance. What is vasopressin? It is anti-diuretic hormone. So diuresis preventing hormone. When there is resistance to ADH, what happens is diuresis. There how polyuria occurs. What are the causes? When we go to the causes, we need to be knowing it's based on the types. There are two types of hyperaldosteronism, primary and secondary. Primary is mainly caused either by idiopathic. We don't know why it's happening. There is too much production of aldosterone. Or it can be caused by adenoma of the adrenal gland, that's known as Cone syndrome. Or it can be genetic. That means it will be seen that there is a familial tendency that runs in families. So these are the primary reasons for the hyperaldosteronism. So there are secondary. Mainly the secondary reason is chronic low BP. And it's mainly associated with congestive heart failure or cirrhosis of liver. This mainly causes chronic low BP and this stimulates a lot of renin production. And when there is too much renin, there will be definitely hyperaldosterone. So that is the secondary cause. How will you diagnose? You need to check the aldosterone and renin level. If there is a high level of aldosterone and low renin, it is primary hyperaldosteronism. Both the aldosterone and renin are high, it is secondary aldosteronism. That's how you will diagnose it. How will you manage? you need to manage the cause. So if it is adenoma, or what's the cause, or if it is the chronic low BP from cirrhosis or congestive heart failure, manage the cause. And the best drug to administer is potassium sparing diuretic. You can remove the excess water retention from there, and hypokalemia also can be corrected. The drug is spironolactone or aldactone, commonly clinically we are using. So that's all about hyperaldosteronism. Practice a few questions on this and stay tuned. We'll be back with another video soon. Thank you.